Let's discuss classical indications of the Yang Qiao Mai or the Yang stepping vessel. Chapter 29 of the Classic of Difficulties says, when the Yang stepping vessel is diseased, the Yin is slack and the Yang tense. This statement is generally thought to refer to the state of the leg muscles. That is, Yin is slack means that the muscles of the middle side of the leg are slack, and Yang is tense means that the muscles of the lateral side of the legs are tight. Although this interpretation is correct, it should not restrict a broader interpretation of the above statement. In fact, Yang and Yin above could also refer to back and front, head and abdomen. Moreover, they can also be interpreted in the broad sense of excess of Yang, or Yang is tense, and deficiency of Yin, Yin is slack. Chapter 63 of the Simple Question suggests using the Yang stepping vessel for eye pain. When pathogenic factors are in the Yang stepping vessel, it will cause eye pain in the inner corner. Needle the point half a tune below the external malleolus twice. This is bladder 62. Needle the right side when the left eye is affected and the left side when the right eye is affected. Condition will be cured in the time it takes to walk 10 li, which is a Chinese mile, which is 5.76 kilometers. This statement is interesting as it recommends contralateral needling, that is, needling the right side for afflictions of the left eye and vice versa. This is presumably due to the fact that the yin and yang stepping vessels cross over the other side when they rise to the head. This is somewhat in convergence with Western medicine, as the nerve tracts from one side of the body enter the opposite side of the brain. Chapter 21 of the Spiritual Axis says, when the Yang stepping vessel is in excess, the eyes stay open. When the pulse of the front position of both left and right side is wiry, it indicates a disease of the Yang stepping vessel. This causes backache, epilepsy, apoplexy, crying like a sheep, aversion to wind, hemiplegia, and tightness of the body. He also says, in epilepsy, treat the stepping vessels, the Yang in men and the Yin in women. The golden mirror of medicine gives the following indications for the Yang stepping vessel: stiff back and spine, wind in ankles and feet, aversion to wind, sweating, headache, numbness of hands and feet, upper arm cold, thunder, headache, red eyes, breast abscess, deafness, epistaxis, epilepsy, limb pain, unilateral fullness, swelling and sweating of the body, dribbling of urination. When the Yang stepping vessel is diseased, the Yang is tense, there is mad walking or mania, and the eyes cannot close. It is interesting to note that in manic patients, one of the characteristic symptoms is staying awake at night, not from insomnia, but from deliberately staying up to do things. So to summarize, these are the classical indications for the Yang stepping vessel. From the Classic of Difficulties, Yin is slack and the Yang tense. From the Simple Questions, eye pain in the inner corner. Spiritual Axis, where eyes stay open. Li Shi Chen, backache, epilepsy, apoplexy, crying like a sheep, aversion to wind, hemiplegia, and tightness of the body. From the Golden Mirror of Medicine, stiff back and spine, wind in ankles and feet, aversion to wind, sweating, headache, numbness of hands and feet, upper arm cold, thunder headache, red eyes, breast abscess, deafness, epistaxis, epilepsy, limb pain, unilateral fullness, swelling and sweating of the body, dribbling of urination. From Li Shi Chen, mad walking or mania, and the eyes cannot close. So we have here a case history of a man of 43 suffering from giddiness and an ache on the lateral side of the legs. His blood pressure was high. His face was red and the muscles on the lateral side of the legs were very tight. He appeared very tense. His pulse was full, rapid, and wiry, and his tongue was red. The Yang stepping vessel was chosen to calm the Yang, relax the muscles on the lateral side of the legs, subdue interior wind manifested by giddiness, and calm the mind. The successive use of its opening and coupled points, bladder 62 on the left and SI3 on the right, produced a marked improvement.